For myself, that's something that I suffered for a lot of years. And then looking up the reduced breathing exercises that you uploaded, getting that experience, that 1, 2, 3 minutes from feeling really uncomfortable of having all my hands and cold feet, and then getting the warmer limbs, it also helped motivate me to continue my practice. So that was a great experience.
Mm-hmm. Yes, absolutely. As I mentioned, actually, when I teach my students, it's one of the three central factors of correct doing breathing exercises, especially Buteyko-reduced breathing exercise, because I always ask my students and tell them that when we do exercise correctly, the reduced breathing exercise, which require nothing, is like central part of the meditation exercise and so on, to slow down your breath. In about 1 minute time, very fast, most students with cold hands and feet, even weather was cold, or maybe room is not cold, or we came having cold hands or cold feet, or both of them, we are able in 1 minute time to get a sensation, or a pleasant sensation of warmness in their hands and feet.
Note that when you breathe more air, you get less O2 and CO2 in your brain and other body cells. Close your mouth, pinch your nose, and start breath holding until you get a desire to breathe more, air hunger or shortage of air. When you release your nose, it is very important that you take your first inhalation through the nose and using the diaphragm or your abdominal muscles. But you need to make this inhalation smaller or shorter than you want or than you had before this exercise. Therefore, after the breath hold, take a small nasal abdominal inhalation, as it is shown on the diagram. After this inhalation, you need to relax all your body muscles in order to exhale. Remember, just relax all your muscles for exhalation. Then again, you take a small nasal abdominal inhalation and relax to exhale, as it is shown on the diagram. Your goal is to maintain or preserve moderate air hunger or desire to breathe more air during this exercise. This reduced breathing results in higher CO2 levels in airways and increased oxygen levels in body cells. Structure of the exercise. 1. Breath holding. 2. Reduced breathing with air hunger and total relaxation of all body muscles. If you suffer from hypertension, migraine, or panic attacks, avoid breath holding and accumulate air hunger very gradually.
Some people, though, I had people who had Raynaud disease, who had years of severe problems with cold hands or cold feet, or both of them, we would need little longer time in order to get sensations. There are actually some students who would require maybe up to 1-2 weeks time of breathing retraining before we experience this positive effect. But eventually, yes, it's of course possible to retrain breath, and that allows people to have normal circulation, normal blood flow to the extremities, and having again pleasant sensation of warmness in the extremities.